Hi everyone. Tomorrow morning, June 22nd at 7 AM, our new Resus department is going to open. So I'm going to give you a quick tour so that everyone knows more or less where things are. This is the ambulance bay, and I'm going to switch the camera and give you a little tour. As ambulances approach the new Resus department, they have two ways of entering. The standard set of doors and the isolation room. The isolation room is for receiving patients with highly infectious diseases, and during the COVID pandemic we will be receiving adult patients with ongoing CPR in cardiac arrest through this entrance. For everyone else, they will be coming in through these doors using a keypad, the code to which is the same as it has been for the old set of doors. As ambulances enter, they have three choices. They can turn left into main Resus, they can go into Resus 1 directly, and that's where we will be receiving the most critically unwell patients, including trauma patients, or they can go straight ahead into the main department. These are our standard adult Resus bays. I'm now going to show you Resus Bay 3. This is our bariatric Resus bay. The difference is that it has a hoist above the bed. The hoist is useful, but it represents a ligature risk, so we will not, under any circumstances, have psychiatric patients in this bay. All the adult bays have a computer on wheels and two trolleys, one with general equipment and one with airway kit, and everything is in a labelled drawer, as you can see. The monitors are as shown. They are Philips and they work essentially the same as the ones you're used to. The little block that comes attached is facing the person at the airway end, and that means that whoever's at the foot end and the airway end will see exactly the same at the same time. We have oxygen on this side, oxygen masks in the blue tray, a Zol defib and an oxylog. On the other side of the patient we have suction, a number of pumps, a ranger for warming fluids, a drip stand with a pressure bag, and as you can see, each bay has its own pat slide and its own trauma mattress. Sink with sharps box and waste bins is as shown. You may find yourself wanting to move the brackets that hold monitors and pumps. There's a couple of tricks you need to be aware of. Most of them can be moved by releasing these screws and then tightening again. The main gantry above can also be moved. There's a button on the side which releases air pressure, and that allows you to move it. You need to press and hold, you'll hear a hiss, and that allows you to move either by rotating or sliding the whole gantry. As soon as you release the button, it will repressurize and it's locked. Resus 1 is our largest resuscitation bay. We'll be using it for trauma patients, but also the sickest patients who need the most space and the most kit. It is designed so that you can stand in the corner as the team leader and see your entire team as well as the monitors. It has an ultrasound, its own venous gas machine, trolleys with airway kit for intubations, a fridge for drugs, and a red trolley that contains hopefully everything that you would need to use for your sickest patients. There are plenty of computers around, including one next to the phones that has a radiology approved screen for looking at imaging. And from this room you can go straight into a dedicated CT with a control room for our radiographer colleagues. This is the dedicated pediatric Resus room. It is set up exactly like the adult ones, with ventilators, defibs and monitoring on the right, suction and pumps on the left when you stand at the foot end. It will also have, they're going to be changing colour, its own dedicated trolleys with airway kit and general paediatric size kit. That space there is where the Resus JR is going to live as of tomorrow morning. And like in the adult rooms, every single adult and paediatric bay has its own bear hugger in the corner next to the plug. Every single one of the new Resus bays is suitable and approved for aerosol generating procedures because of the number of air exchanges that we are delivering through the new ventilation system. If you deliver an aerosol generating procedure in one of the bays, you need to wait 30 minutes before the room or bay is safe to enter in normal level 1 PPE. So essentially you deliver your aerosol generating procedure, you doff before you leave the bay area, and then after 30 minutes staff can come back into that room in level 1 rather than level 2 PPE. Once the patient has left, the room will need a deep clean. We do, however, have a dedicated isolation room in which we can also deliver aerosol generating procedures. The lobby to the room generates positive pressure, stopping any pathogens in the air inside the room coming out through the lobby. The green light on the wall indicates that the seals are correct and that the system is working. Access is with a card. You have to push hard because of the positive pressure. And inside is the lobby where you can don and doff, and deliberately the floor has a split between red, which is unsafe or dirty, and green, which should be clean. So the idea is that when you're coming out, you doff on the red zone, then step into the green zone before exiting into the department again. The beauty of the isolation room is that it has a lot more space, particularly at the head end if you're intubating patients. Consideration should therefore be given to intubating patients in this room because of that extra space for whoever's doing the intubation at the head end. Because we will be receiving adult patients with ongoing CPR in this room, we also have the Lucas in here ready to go. Patients come in directly from the outside via that set of doors. As you come into Resus from the main department, there's a dirty utility, a stock cupboard which hopefully contains most of what you need, including John Walker. This is the paediatric bay, bariatric bay, standard bays, and in the middle of the department we have our point of care, venous gas and TEG for clotting.